Hello, I'm Dr. Garcia Faura, Assisted Reproduction Specialist at the Institut Marquès in Barcelona, Spain. I will be talking about IVF treatment availability in Spain. Spain has one of the most advanced assisted reproduction legislation in Europe. The legislation, approved by the Spanish Parliament in May 2006, allows any woman over 18 years old and in full capacity to act, to receive or use assisted reproductive techniques regulated by law independently of her marital status and her sexual orientation. Therefore, single women, married heterosexual and homosexual couples, and legally registered heterosexual partners qualify for assisted reproduction. Our law provides for reproduction techniques to be used not only to treat fertility issues, but also for reproductive life planning, for example, choosing a single parenting or postponing motherhood by means of oocyte cryopreservation techniques. Unlike other countries in Europe, egg and semen donation in Spain is anonymous, and therefore the identity of the donor can never be revealed. In Spain, 50 years old is the age limit for receiving fertility treatment. This is an agreement between all Spanish clinics, taking into account the risks entailed in such a late pregnancy. But patients might be warned that at a certain age it's time to turn to donor egg IVF. Female fertility decreases with age, especially between 10 and 15 years before menopause, with a decline in the quantity and quality of the eggs. The chronological age of women, the one stated on their ID, does not match their ovarian age. The delayed maternity makes a precise evaluation of the ovarian reserve necessary, since at the age of 35, only 10% of the eggs are left, and these, the less they are, the worse the quality is. Currently, the clinical marker of election is the concentration of the anti-Mullerian hormone, AMH, which is obtained via blood tests performed without need of fasting. This hormone is produced by cells in the ovarian follicles and does not vary during the men's cycle. As I told before, Spain legislation, Assisted Reproduction Law 14/2006, allows single women or homosexual couples to access assisted reproduction techniques in order to have a child without the need of being married. A woman's access to assisted reproduction techniques is independent of her sexual orientation and marital status. This legal advantage adds onto Barcelona's renown for being the capital of European reproductive medicine. Artificial insemination, IVF with sperm donation, IVF with sperm and egg donation, and embryo donation or adoption are the assisted reproduction treatments suitable for these patients. It is not necessary to be married or to have a partner. From a legal perspective, the reciprocal IVF technique, also known as Roper method, offered to lesbian couples, is the only treatment that requires being married to be able to perform it.